but high glycemic fruit is not a good thing.
Mm.
I've seen it where people eat basically a close to the earth diet, right? Where they basically wreck their diets eating all these high glycemic foods, which
Welcome back to another episode of the Peak Performance Life podcast. Today, I am extremely excited to have my good friend, Dr. Chanu Dasari, back on with us. Dr. Chanu is a gut surgeon. Okay, so there's a lot of people who talk about being gut health experts or acting like they know what they're talking about when it comes to gut health. But here is someone who actually operates on the gut and knows what's going on the inside, sees it firsthand. But even though he is a surgeon, he's also, in my opinion, very holistic, very looks at things not just from the lens of kind of like an old school surgeon who just wants to cut everything, but also has a very holistic approach and is really incredible at helping his patients, teaching them, educating them so that they hopefully never have to have another gut surgery when it's all said and done, right? So thank you so much for joining us, Dr. Chanu. Real quick, before we get started, if you are a repeat listener, we do ask that you please subscribe, rate, leave us a review. That really helps other people find us and helps us move up the rankings. And if you find value in this episode, please share it with a friend as well. And with that, Dr. Chanu, thank you for joining us.
great. Thanks, Talor, and thanks for having me on the Peak Performance podcast.
Excited. I want to have you back. I feel like I could just talk with you every week about health. Every time we hang out, we always have so
That's all
much
we
to
talk
talk
about.
Yeah. Well, let's talk about gut health. Since that, to start with, I know we have a lot of things we could talk about, but since a lot of gut health is such a hot topic, and you are truly the expert, not just someone who came up with some gut health product. What are some of the biggest, just talk in general about gut health, some of the biggest things you've seen and some of the biggest mistakes and some general practical advice?
Yeah, gut health is having a moment. And I think it's because so many people realize that the GI system is central to so many of the processes in the body. Let's take inflammation, for example. Inflammation, as we know, leads to a lot of things. It leads to, things like SIBO, Candida, IBS, Crohn's, colitis, anxiety, depression, lupus, chronic fatigue, aging, eczema, psoriasis, migraines, fibromyalgia, neuropathy, diabetes. Something as simple as inflammation is triggered by the immune system. And as we know, 80% of the immune system is actually contained in the GI tract.
Mm.
So if you talk about gut health, it's really talking about immune health. And when you talk about immune health, we're talking about anti-aging, we're talking about things that go along with the immune systems like autoimmune disease. So a lot of these things tie in. And a lot of people, at least a lot of clinicians I know, are so quick to just judge and assume that problems in this arena are due to things like genetics or just that's just the way things are. When we actually see there's changes in this GI system that are day by day, hour by hour. There's an American gut project that has sprung up in the last 5 to 10 years, and they're actually looking at the milieu, the makeup of the microbiome in the intestines, just to see and be able to predict if someone's going to have a disease. And it turns out that they can predict, say, if you're going to have an exacerbation of your inflammation, they're able to predict within 2 or 3 days based on what kind of poop you have in the stool or in the toilet, they do a
Wow.
stool analysis. And so we've now gotten to the point now of, instead of blaming genes and blaming someone's like makeup, genetic makeup, to now seeing that most of genetic diversity, almost 99% of the genetic diversity in someone's body, is actually coming from the gut microbiome. And so if we know that, and if we know that it plays such an important role in what we do, it's something that from a preventative health standpoint, from a holistic standpoint, even from a day-to-day standpoint, that we really need to pay attention to and not take this haphazard approach to that portion of our health. Until now, we could blame it on lack of knowledge, but now we have the knowledge and now we have the resources, and we can control some of these risk factors that we didn't really understand even just a few years ago.
Yeah, yeah, and I know your new clinic is called the Mind Gut Immunity Clinic. So kind of I love that name. And you recently spoke at Stanford as well. And so, with regards to this, well, before we get into some of the basic things that people can do for gut health, what are some of the sort of whether it be a disease or condition, it may be a better word, that you see lots of people coming into your clinic with that they maybe didn't realize, or again, you mentioned rheumatoid arthritis, right? Most people would have never make that connection to gut health, right?
Right. Yeah, there's a lot of conditions. Let me just talk about the autoimmune conditions first.
Yeah.
I'll even break it down: mind, gut, and immunity. Okay.
Mm,
So, for example, from the mind perspective, right, you have a lot of neurologic conditions that are associated with a altered gut microbiome and intestinal flora, things like multiple sclerosis, neuropathy, fibromyalgia, headaches, migraines. Okay, even mood and depression. It's at Harvard, they're actually doing stool transplants for depressed individuals. So they're taking the the stool from a happy person and putting it
right.
into a sad person, and they're fixing depression.
It's
Okay,
crazy, huh?
so
Yeah.
it's
By
crazy,
the way,
right?
don't try this at home,
Yeah,
people.
don't try this at
It's,
home.
it,
It's
it actually can be
professional.
very dangerous. It's for people who try to do
Professionals.
it on their own. Yeah.
I actually have a way in my clinic to do that without having to take someone else's stool. So that's a whole different conversation, right? Well, I'll talk about
Wow.
that.
Nice.
But so that's the mind, right? And if you
And
look
so
at
those conditions that you just mentioned, real quick, just to be clear, you're saying that a lot of times people don't realize, like even multiple sclerosis could be caused by issues in the gut, could from poor, unhealthy habits and things of that nature.
Absolutely. Let's take a look at multiple sclerosis specifically. There was a diet, even I want to say invented 30 years ago in the 90s, called MS Swank. And the
Hmm.
MS Swank diet it's basically if it's a phytonutrient diet essentially. Okay, so it's a diet that basically optimizes the gut microbiome. We know that now. Back then, they didn't really know sort of the mechanisms that led to it, but
Mhm.
and in these studies, it shows that if you follow this diet, you can stop the progression of multiple sclerosis in 96% of patients. It's that high, that high. So, if you fix 96% of people with a certain condition, some would say that's a cure, right?
Wow. Yeah.
And
Uh-huh.
so if you think about it, maybe multiple sclerosis, we're blaming it on genetics and all these other things, but maybe it has to do with the deficiencies in phytonutrients. Maybe it has to do with micronutrient deficiency. Maybe it has to do with intestinal flora dysfunction, right? So it's a different way of thinking about a neurologic disorder, right? Here we're thinking it's like all these plaques that are in the brain. Well, yeah, I mean, the plaques are there, but the brain and the spinal cord, they're the bystander organ. They're not the
Wow.
organ that are causing this. This
Yeah.
is starting in the gut, starting with the immune system.
Yep. Yep. That's great. So that's incredible information. And so you're talking about all the other autoimmune diseases as well that were that could potentially be caused here as well, right?
Yeah, I have people in my clinic with Sjogren's, mixed connective tissue disorder, inflammatory bowel disease. These people are on multiple medications when they come in to see me. And the first thing I do is I reset their microbiome. That usually takes about 1 to 2 weeks. And I do it forcibly with some patented strains of probiotics. Then I
Hmm.
put them on a phytonutrient diet, which is a very, very specific diet to their condition, and that it's evidence-based. And then the rest of it is I focus on the other variables such as sleep, stress, and exercise, because all of these things can alter intestinal inflammation. So it's this very involved 3 month sort of protocol, but it fixes people. People get off of their medications. I would say most people see at least a 50% improvement in the first 6 weeks. That's with no medication added. And most people see about 80% resolution in symptoms. I have a gal actually who is off all three of her immunomodulating medications, and she's only week 6 into the program. And
Wow.
this is somebody that has had inflammatory bowel disease since the age of two
Hmm.
years old. She's been seen by the likes of Mayo. She's been seen by the likes of Johns Hopkins. Really couldn't get anywhere because nobody sat down with her and said, hey, these are the risk factors that are leading to your dysbiosis. These are the risk factors leading to your inflammation. Here's a way you can fix it. right? Here's a system that's pretty reliable and predictable. See, a lot of clinicians, they don't spend that time, right?
Mm.
That takes a lot of time. It takes a lot of expertise. You have to know what these levers are in order to fix them. So
You have to have the knowledge, and then you also, I mean, I assume you're sacrificing profit by not sending them straight into surgery and
sure,
working
it's
on them
bad.
in an alternative way.
I tell them it's bad for business. I tell a lot of people, they come into my clinic, they say, "You're a surgeon, aren't you supposed to cut?" I say, "Yeah, this is bad for business, man. I'm making you better without an operation." But that's why they keep coming back, and they refer their friends and family. And I have developed a reputation in this field, in this area. I have people coming in from out of state, out of country, around the world, actually seeking treatment. So it's something I am proud of. And so be it. I don't get to operate on these folks, but that's a good thing. That's a good thing for everyone, really.
Absolutely, absolutely. Um, so yeah, go ahead. You were going to say something else?
So that was mind, right? We discussed the mind.
Yeah.
So here, the gut, right? We have conditions like SIBO, Candida, IBS, Crohn's, colitis. Okay. And then when you have immunity, that's all the autoimmune conditions, right? From ANA, which is anti-nuclear antibody positivity. You have things like lupus, chronic fatigue, eczema, psoriasis, which are actually skin conditions, rheumatoid. They have these things called mixed connective tissue disorder, which is like a overlap type disease, and Sjogren's syndrome. This can result in dry eyes, allergies, even. So there's a lot of things from the immunity standpoint, from the immune system standpoint, that is also affected by the gut. So these are all conditions. These are why people try to seek me out and get treatment in my clinic.
Mm, mm. So what, I'm wondering, should we go more down that road, or more start talking about what can people do if they have an issue, but maybe it's not that bad, so they haven't been to a doctor yet. Maybe some tips around, just general gut health advice.
Yeah, I'll just give you some of my top, what I would say my highest yield suggestions. Most people think, at least in the United States, okay, most people think if you poop once a day, you're good. Okay. Around the world, though, it's not the case. Usually about 2 to 4 bowel movements is normal. It's
Wow.
desirable, in fact. And if you think about it, think about what I'm trying to say, right? So if it takes 24 hours for food to move from basically your mouth to the other end, right? That means it's 24 hours that the food is just festering there with all this bacteria in it, right? Not only getting fermented once, but probably getting fermented once, twice, 3 times, 4 times over by different sets of intestinal microbiome or intestinal microbes, that by the time it leaves the system, it's created so much inflammation that you don't even think about it. And most people are used to it, right? Most people have already said, "Oh, I go once a day, I'm regular, I'm fine, I'm normal." That can't be the reason. I have great gut health. That can't be the reason I have an issue. Well, no, actually, that might be one of the things that are wrong, right? That might be
Hmm.
one of the things wrong. So I've seen it, whereas people, when they start going maybe 2, 3, 4 times a day, where actually a lot of these problems get better. A lot of the problems get better.
Interesting.
And
Well, how
sometimes
how
you
do
get
we
it.
how do we how do we make that happen, I guess? Because for me, I eat healthy, I would say, and luckily for me, it's first thing in the morning every day, which is great. When that happens, sometimes when I travel or have a different type of diet, I can throws me off, and that might mess me up. But I consider myself pretty healthy, and for me, it's usually just one a day. What would be how would people have more than that?
Yeah, I would suggest, so a lot of people in a normal diet will have around 20 grams of fiber.
Hmm.
That's low in my opinion. If you look at primal diets, ancestral diets, when we were, hunter gatherers, we would have about 1 gram of fiber for almost every 20 calories of carbs. So in a given like 2000 calorie diet, that's almost 100 grams of fiber.
Mm.
100 grams of fiber in an equivalent diet. Now, that's unrealistic. You ask somebody nowadays to have 100 grams of fiber, it's not going to happen. So I think a good goal is actually around 40 to 50 grams. And that the fiber does a couple things. One, obviously you have bowel movements, but the second thing it does, it gets converted into short chain fatty acids, which is fuel for your colonocytes. So your colon, the cells in your colon survive on those metabolic nutrients from the fiber itself. So that's one thing that, everyone can do. It's natural. It doesn't increase the glycemic index of your food, and it will allow you to have just better intestinal health.
So do you recommend then, what are some ways of, for people who are like not eating like myself on the paleo sort of, no bread, no pasta, things of that nature. Obviously I'm eating plants, I'm eating eggs and grass-fed meat and things of that nature. It might be hard for me to get that much more without supplementing, right? With prebiotic fibers, which I do take prebiotic fibers. Actually, I put a scoop in my morning coffee of our Peak Performance prebiotic fibers, or you could throw it in your smoothie. And then I'm also taking psyllium husk now at night as well. I take a couple capsules of that, 1.2 grams of psyllium husk at night. Is that good? Should I be doing more than that? Is there, what other foods that you really like also are high in fiber?
Yeah, let me split this up, because I'm going to split this up with foods that are paleo low carb friendly, and foods that are maybe medium carbs, I would say slow carb friendly, and then ones that are like no carbs. So the no carb options you have is psyllium husk, right? Psyllium husk is something you can add to basically anything. I suggest you add it to your protein shakes, because you can add several scoops of it, so more than just like, say a gram or two. And it's a great way to get a lot of fiber with not a lot of effort. So that to answer your most basic question, psyllium husk is great. Now, from a low carb perspective, I think avocados, for the amount of space for the amount of space it takes up in your stomach, it actually has quite a bit of fiber. I would say. Obviously, you have your low glycemic vegetables, like any green vegetables, but it turns out they don't have a whole lot of fiber. They have a lot of roughage, but not a lot of fiber in them always. One food that I really like, and this was made famous, I think, by, Tim Ferriss said a lot about the slow carb movement, but is oat bran. Okay, so like Bob's Red Mill has a product that you can buy in like most grocery stores called oat bran. It's not oatmeal, it's oat bran, and the amount of fiber is 3 to 4 or 5 times what normal oatmeal is.
Is that gluten free though, or does that?
Yeah,
okay,
that is
good.
Yeah, it's just oats, right? It's not. It doesn't come from any wheat sort of source. So it's really good, and I see a lot of people who just add that to their morning shakes if they don't want to do the psyllium husk, or just eat it straight up, as a cereal alternative, because as we know, cereal is just super high glycemic, right? So those would be like my top 3. There are others in that list.
What about blueberries and other berries?
Yeah, blueberries, other berries, they have a lot of fiber for the amount of space. They also are really high in other phytonutrients, obviously like polyphenols. I think they're more valuable for those sorts of things, but you also have things like mushrooms. And if people are trying to, I would say a lot of folks eat food that have high amounts of sugar and calories without a lot of fiber in it, right? So they need to start replacing those foods. For example, things like rice should probably not be in a lot of people's diets. Even the brown rice doesn't have enough fiber, in my opinion. Quinoa you can get away with, right? So quinoa has a lot of fiber. So the fiber ratios, like if you look at quinoa versus white rice per calorie, you actually have a lot more fiber in something like quinoa. So it's just replacing a lot of these foods with low fiber indexes is a starting point. And if you're to the point where you are, which is basically eating a lot of healthy foods throughout the day, then just adding it or supplementing it would probably be sufficient.
Nice. I'm definitely gonna uptake my my fiber intake based on that. That's good stuff. Great. So talk about a little bit, because you're called the Mind Gut Immunity Clinic, right? Talk a little bit about a little more about the mind gut connection. I know there was a book called The Mind Gut Connection someone wrote, but I don't think many people fully grasp this idea.
Yeah, so The intestinal system, the gut has its own nervous system, and it's called the enteric nervous system. And most people know about it, but they don't know exactly what it does. It does a couple things. One, it produces most of the neurotransmitter in your body. So things like serotonin, things like histamine, things like epinephrine, noradrenaline, all of these things are derived from intestinal organs to begin with. So even these neurotransmitters that your brain uses to think about problems or perform tasks, they're actually being created in the GI tract. So that's one. Second thing is there's a mind-gut connection as well, right? So this enteric system is attached to the brain via the spinal cord. And this enteric nervous system, whether even if people that are brain dead actually have function in their enteric nervous system. And so there's this dual feedback from the brain to the intestine, and then from the intestine back up to the brain. And so they're constantly sending signals that you're not even aware of. Okay, you're not even aware of this. So they're sending sort of these text messages, these signals, and there's this crosstalk that affects behavior. And so that's what they've even seen. They've even seen like the types of gut bacteria, for example, in your intestines can affect who you're attracted to, or what you decide you want to eat. So let's say you have a craving for something that's high in sugar. Well, that's probably because the bacteria in your GI system is telling your brain, hey, maybe you want to go eat some of that.
Yeah, I mean, I can tell you when I change my diet, my cravings, after a while, your cravings go away. People don't believe me when they're like, you that cake on the table, you really don't crave that cake right now. I'm like, no, I really don't crave that cake. I guess my gut is sending me good signals.
That process takes 3 weeks to lure.
Mm,
3 weeks. There's an adjustment period, right? Because I see a lot of sick people in my clinic, and most people are at this basically a normal diet, standard American diet, I want to tell you. So that's their starting point. So for them to go from that to not having these cravings, not wanting these cheat meals, not feeling like they're missing out, that process takes 3 weeks. And it's very hard to describe that process to someone that hasn't gone through it.
mm,
Because if they don't know what it feels like to not want those things, if that makes sense, right?
right.
So it's possible, because what happens in that 3 week time is, guess what? Your intestinal microbiome shifts,
Mm,
and it shifts in a very dramatic way, in fact. So once it shifts, you're not having this constant catch up where you're just like, I need to feed the invaders in my intestines because they're
yeah.
telling me to, they're holding me hostage, right?
Mm-hmm.
They're
Mm-hmm.
holding me hostage. And guess what? Maybe your taste in romantic partners might change after 3 weeks.
Oh man. What are the gut wreckers? Like what are when people come in and they're all messed up, they have gut problems, and you're just like, okay, you have to stop eating or drinking this.
I would say the number one thing that people think are super healthy but aren't have to do with has to do with fruit. So a lot of people think fruit is healthy, and so they eat a lot of it. These are also it's pretty significant in like dietary sort of circles to be doing this too. And the reason I picked out fruit, obviously there's other things like cookies, candies, sweets, sugars, right? And those are very obvious, but fruit is one of those things that I don't think a lot of people pay attention to. And I'm not even saying all fruit is bad. I'm actually saying fruit is good, but high glycemic fruit is not a good thing.
Mm,
I've seen it where people eat basically a close to the earth diet, right? Where they basically wreck their diets eating all these high glycemic foods, which is why like the whole paleo movement exists, which is why like the carnivore diets exist, right? The most of the benefit of the carnivore diet, I mean, yes, you get the meat, you get the protein, but it has to do with the glycemic index of the food,
mm,
right? And people think, oh, well, I'm eating fruits, they're natural. Well, yeah, but the fruit that we grow nowadays has so much higher sugar, so much lower fiber that it just spikes insulin. It feeds this bad bacteria in the gut. And then people are drinking fruit juice.
oh, yeah.
They're drinking other juices with fruit extracts for flavorings, right? And so all of these things, anything that's not water that people are drinking that has these, and that's the second thing I would say. So fruit's probably one of them. I'm not vilifying all fruits. I'm saying just pay attention to whether something is high glycemic versus a low glycemic fruit. Low glycemic fruits, examples are like berries.
Yeah, those berries are the only fruit that I really eat these days, mostly blueberries, and it's because of that, the glycemic
Right,
index
because
on
the
them. Yeah.
glycemic index. But there are high glycemic index fruits like ripe bananas. Ripe bananas are super high index.
Right.
Um,
Mangoes, I think.
melons,
Yeah. Melons,
melons
mangoes,
is pretty high.
watermelon. Yeah.
Yeah,
Mm.
all the ones that are great, all the ones that are good, they all taste great, but it's like candy, right? And it's fructose, and fructose actually is even worse than some of these other things you could be eating too. So I'm not saying don't eat them. I'm sort of making a bigger point, and that's to say I don't think we are eating enough fiber to justify us eating that much fruit in a typical diet now. That's the comment there. And then we're
Yeah.
trying to offset that with using artificial stuff, right? We use all these artificial sweeteners and tastes to, supplement things like water. Like, when did water ever need a supplement, right?
Right.
Associated with it. So
Right. Exactly. And I
that would
think
be number two.
what's yeah, I mean, and I agree. It's for so long everyone says fruits and vegetables, like just categorizing them all the same. It's like, no, fruits are not the same as vegetables.
Yeah.
You know, so I think, yeah, I agree with you 100% on that. Yeah, what else were you gonna say?
Well, number two was the artificial sweeteners. I think
So
even
like
though
Coke Zero, the Coke Zero craze that's going around right now, right? It's 0 calories, so not can't be that
yeah,
bad.
you remember the discussion we had when we were at that conference about these alcohol sugars, where we're walking by these
Yeah.
stalls, and you're just like chuckling and saying, "Ha, this stuff is horrible. I would never put this stuff in my products." I said, "Good for you, Tiller, because there's a lot of people that cut corners,
Mm,
right, and do add this because people think, oh, well, I'm not getting sugar. You can say sugar free." And so they just automatically assume that it's healthy. But if you look at these artificial sweeteners, even if you look at some of these sugar alcohols, granted, they may not increase your insulin necessarily directly, but what they
mm,
do is they change the makeup of your intestinal microbiome in a not so favorable way.
mm,
And so you're still getting a lot of damage from these things. And people are just eating it thinking, oh, well, there's no consequence. There's nothing bad that could possibly happen with all these artificial ingredients. Well, yeah, even though it doesn't necessarily spike your blood sugar right then and there, it'll change your intestinal microbiome makeup, create a more pro-inflammatory cytokine profile, and cause problems just basically in the same way that a lot of these sugars do.
mm-hmm,
So I think
mm-hmm.
that's a very important takeaway. And then then there's obvious things, right? There's obvious things that a lot of other people have talked about more than just on this podcast. Things like processed foods, sweets.
Mm-hmm.
I think those are some big ones as well.
Mm-hmm. Mm-hmm. So you're basically the probiotics. So you're basically having people come in, you're changing their diet, you're putting them on probiotics to sort of reshape their gut bacteria. Um,
It's a
and
lot
you're
more involved in that.
yeah.
It's yeah, that's the most basic way of describing it, sure.
Mm-hmm,
But for example, just to change the intestinal microbiome, it's actually a lot of work.
mm-hmm,
You have to empty your bowels 4 times a day. You have to replenish them with good microbiome or with good supplements 4 times a day. The actual probiotic strains have to be patented with um, good data behind them, especially for the condition that are being treated. And this process is a lot more thoughtful. But yeah, that's in essence, that's sort of what the first several weeks look like. That's what we focus on.
nice. Um, well, let's shift gears a little bit. Let's talk a little bit about you. And has your diet changed at all in the past year? I know you just told me you put on about 30 pounds of healthy weight, mostly muscle, recently. So tell me about your thought process there and what changed and how'd you do it?
Sure. I have to put in a little plug here. I did get a trainer. His name is Byron Ross. So you can find him on Instagram. I think he's putting out some videos on YouTube now, Byron Ross Fitness, also known as Mac Ross because he's into macros, Mac
Mm,
Ross. So he is the number one over 45 bodybuilder in the United States right now. He actually just won this last couple weekends. He won 2 competitions in a row, 2 professional competitions. and he won them in the IFBB, which is it's like the most prestigious bodybuilding competition. And a lot of those guys, they're taking some items to boost testosterone and things like that. But he's all natural. He's been all natural since the beginning. He was a former college athlete, and I've seen what he does for his nutrition. It's basically spot on. The reason I mention him is because I always told myself that I was a skinny, slim kind of guy, right? I was eating this these like very restrictive vegan type diets, and it was working for me because as you know previously I've actually dealt with autoimmune disease in my early 20s, so I was super careful, super restrictive, right? And so once I got over that, but I never mentally really made that leap of, okay, now I really need to build something here, right? It's not just avoiding everything because I'm afraid. I'm not in a pro-inflammatory state anymore, right? So I can do more. So, I hooked up with, I linked up with Byron. So I started a pretty in-depth training regimen and nutrition regimen, and I increased the amount of protein in my diet almost about 180 grams, which is a lot. That's a lot
That's
of
a lot.
protein. That's a lot of protein for most people. I don't recommend it. I just want to tell you that I don't recommend it. But what it does do is it builds muscle. It builds
Yeah.
muscle really fast, especially if you're doing essential amino acids, branched chain amino acids. It's a really good way of building lean muscle, and I want people to know that that's a valuable thing. Muscle is not just to move items. It's actually an endocrine organ. It's an anti-inflammatory organ. The muscle itself secretes chemicals that prevent inflammation. So the more muscle you have, the better. They can actually tell if a person's aging faster than usual based on the muscle mass inside of them, right? There's these CT scans that they look at, and they look at these things called the psoas muscles, which are these muscles near, next to the backbone.
Mm-hmm.
And depending on the density of these psoas muscles, they're able to predict how robust the person is, basically how old, how frail this person is. So it's important to strength train. It's important to build muscle. So I realized that all in the last year, and I'm always someone that's action oriented in general. So I gained almost 30 pounds of just muscle, and it's been great. I feel wonderful. And I've adopted a less strict diet, I would say. I'm not as I still don't eat a lot of meat. I'll just be honest with you, but
Yeah.
that's just more of a personal decision. But in terms of protein, it's a lot of protein. It's a lot of phyto oils. It's a lot of fiber. It's a lot of phytonutrients. So there's a lot there.
Mm-hmm. Mm-hmm. Yeah. For some reason too, red meat, I've just been naturally, again, I'm more of an intuitive eater recently, and just intuitively, my body doesn't crave red meat that much. I might eat it maybe once or twice a week. But for the most part, I'm loving salmon. I love,
Wild caught salmon's great.
yeah, wild caught salmon, organic pasture raised eggs.
Yeah.
Those are probably my main sources of protein, other than protein shakes and
Yeah.
stuff like that. So yeah.
Yeah, I would say, the meat we have nowadays is not the meat that our ancestors had. And so,
Hmm.
the wild game meat has a completely different fatty acid profile than stuff that's you find in the grocery stores. It's completely different.
Hmm.
And so we try to get close to that. We try to get close to that by saying, "Oh, let's try grass fed," right? Which is obviously better, right?
Hmm.
But even that is like, sometimes you don't even know, you don't actually know, right? You don't really know. There's not somebody testing the fatty acid profiles of even those. We're just assuming that it's less risk than, say, conventional meat, which I think is clear.
Hmm.
But there are probably better choices to be made even in the meat category. For example, meat has GLA, right? It's a form of omega-6, which omega-6 a lot of people vilify, but if you have gamma linoleic acid, it's actually good for you. GLA is higher in grass-fed animals, but even higher in just wild animals. So,
Hmm.
wild game has high amounts of GLA.
Yep.
it's very hard to find that, right? Where are you going to find that? I mean, you'd have to be, know your butcher and know your local hunter, but,
Yeah.
or go hunt yourself, right? So,
Right.
but yeah, I think there's easier ways. Like wild caught salmon is great, very good fatty acid profile, very good omega uh, profiles, and so it's almost like you want to eat more of those things, right? Instead of relying on these things that increase arachidonic acid in your body, increase other inflammatory cytokines.
Mm-hmm. Mm-hmm. Well, let me ask you a little bit. Let's go back to some of the conditions that you're treating. And I know you just recently created a bunch of training programs, educational training programs as well, directly related to certain conditions. So before we wrapped up, I wanted to make sure we talked about what are these educational programs. What conditions do you currently have them available for, and how are you sort of helping people? Because I know you put a whole bunch of videos up on YouTube. It went viral. Things have been going crazy. You're getting tons of people contacting you in your office now. So I definitely want to make sure our listeners also have this opportunity if they're suffering from any one of these conditions.
Yeah, thanks. The 10 conditions I'm targeting are lupus, rheumatoid arthritis, multiple sclerosis, eczema, psoriasis, fatty liver, IBS, which also includes Candida and SIBO, Crohn's and colitis. These happen to be I would say, the 10 most common either autoimmune or inflammatory disorders, digestive disorders that people deal with. There are other people with, for example, other types of autoimmune disorders like Sjogren's, mixed connective tissue, that also come and see me, and I just give them one of these courses. I offer free training on mind gut immunity clinic.com, mgiclinic.com. People can go there, enter in their email, and they get a free training, and just to see what the whole thing's about, and then they can sign up to be a part of the clinic. It's great. And it's really simple. Most of this can be done from the comfort of your home. It doesn't involve spending a whole host of, you don't have to buy a bunch of very expensive supplements. Actually, a bunch of the peak performance supplements meet the criteria for a lot of these requirements. Because if you think about it, at the end of the day, one part of this is awareness of superfoods, awareness of phytonutrients, and part of that awareness is knowing what's on the label and knowing what the product is. And so, you obviously make very high end products with, and I know you don't skimp on the quality, just I know what goes into the R&D. So a lot of these things go hand in hand. It's just a great course to get educated on gut health, fix your own problems without the need for surgeons or doctors. And if you want to work with me directly, you also have the option.
Great. So that's mgiclinic.com.
Correct. mgiclinic.com. It'll take you to a homepage where you can choose your condition. And after that, you just plug in your email and you'll be on your way.
Nice. And I mean, I highly recommend anyone who has these conditions. Sometimes people get these conditions, they start reading up about it on the internet, they start thinking they need surgery right away. What would you say to that? What would you say to people who kind of think, oh, I need surgery, I have this condition?
Yeah, I get that a lot. I need surgery. Or the other one I get is, I've been taking immunomodulating medications, and that's the only option I have, right? In a lot of these autoimmune conditions or inflammatory bowel conditions, for example, the doc they only have one trick. The only trick they got is medications or surgery. And most people, they want to start somewhere else. They want to start with, well, why did this happen? There was a point in my life where I was healthy, right? Where I had all these so-called, genetics or whatever, right? But I didn't have the disease. And so there seems to be a disconnect, right? Because in a doctor's visit, typical doctor's visit, it's only like, say, 15 minutes or so. So, and, they don't have a lot to talk. They say, hey, here's the disease, do a little bit of reading on it. Oh, by the way, here are the medications I can give you. And then that's it, right? And here are the tests, and here, but there's no discussion about, hey, this is probably the top 5 causes. These are how you prevent them. And I think that when people are looking for that alternative, the only place they can look are these sort of alternative doctors, which it's a whole different problem, right? If you're going to just alternative healers and things, because then you don't know if everything that they're doing is evidence-based. And that's a whole, it presents a different set of challenges. Mind you, I've met some very good functional medicine doctors, some very good holistic healers in my lifetime. So I'm not saying that the entire profession is bad. I'm just saying it's really hard to vet the quality of some of the advice that you're getting. And you also sometimes get incomplete advice, right? So those folks are all like their mind space is only in the holistic and alternative, and the nutrition that they sometimes will miss some very big glaring thing. And Western medicine physicians, they miss stuff all the time. Like when I review charts, I'll find things that were missed in somebody's care, and I say, hey, did you look into this? And they were like, no. And that it ends up that is the root cause of their problem. So you kind of need both perspectives, I would say, or someone with at least expertise from both sides. And we were always taught the first thing that you do for a lot of these diseases is not just jump to medication or surgery, but it's to try things that will prevent that disease. Prevention is always key, right? Prevention is better than cure, right? Or prevention is worth a pound of cure, right? But you should always try to figure out what's causing a disease and fix that issue. But that's the hard job. It's easy to prescribe a medication. It's actually easy to do a surgery when you're trained, but it's very hard to identify what the actual causes and drivers of inflammation are and to appropriately address them. And that's where I would say my talent is. I've really developed a reputation in my clinic for this, for my patients. And it's just been a really great thing.
That's amazing, man. And that's why I love you, bro. That's amazing. It's great that you're doing that. And I would also imagine many people that have surgery end up, if they don't change their lifestyle, their nutrition, they're just going to end up having the same issue, whether it manifests as something else or the same thing again, right?
Yeah, I tell people when you come to me, it's because every other thing failed to this point, right? So now you need surgery. You need surgery from one of your intestinal organs, right? That's a big deal. It's a big deal, right? You think that may be the only thing wrong. No, there's probably other stuff wrong in your body. And that's sort of, I spend a lot of time in my clinic talking about that, that really just describing that there are a lot of other big things going on that they need to pay attention to. And so understanding that the intestines are just like, the surgical disease is just one part of it, right? The driving factors, the inflammation, the mind gut immunity part of this whole equation, that's what's wrong, and that's what people need to change.
Amazing, man. Well, so mgiclinic.com, anywhere else people can follow you or learn more from you? Or is that the main one?
Check out my YouTube. It's Dasari MD. I'm also on TikTok, where I post a bunch of surgery videos. If you end up needing some kind of intestinal surgery, there's a separate website. That's dasarimd.com, but that's only for surgical issues. If for autoimmune, gut health, mind gut immunity related topics, mgiclinic.com.
Nice. Wow. Surgery videos on TikTok these days, huh? This is
yeah, they took a bunch of them down. You got to scroll through and say, yes, I want to see the graphic content. But you'll see some graphic content.
Oh man, I'm glad I'm not on TikTok. But anyway, man, it's it's been great. Thank you so much for sharing your knowledge. This was really good stuff. I'll definitely be increasing my fiber intake. And I hope anyone, if you or anyone has any one of these conditions that the doc just talked about, please, go to his website, get more information. You get free training videos. Then I think he has a further educational course. If you like what you see, you could work with him as well. And there's nobody that I would more highly recommend, especially if you have one of those issues. So thank you so much for joining us here today. And I'm sure we'll do another podcast episode again in the future.
Thanks for the kind words, Talor. And I appreciate you bringing me on for your viewers and bringing a lot of value to the Peak Performance family.
That's what we're all about, man. Thank you so much.
See ya.
See ya. Thanks for listening, and just a reminder, if you haven't yet tried any of our Peak Performance products, you get 20% off your first order. We have one of the largest selection of USDA certified organic superfood powders, as well as very high quality supplements, and you get 20% off your first order at buypeakperformance.com. That's www.buypeakperformance.com.